Okay, today we're going to do 3 videos on different aspects of hypertension, high blood pressure, starting off with fetal hypertension, pregnancy hypertension, and then the more familiar adult hypertension. This work's been done in Shanghai, largely, with some assistance from a group in Wenzhou. Colleagues in Shanghai were Wang Yanqiu, Wang Yuan, and in the Department of Pathology run by Zhang Huijuan, and the hospital leader is, of course, Huang Hefeng. Now, intrinsically, as I say, you can't measure a baby's blood pressure with a cuff or a catheter. You have to look at histological changes in order to make this diagnosis. So what we're going to do is look at some important sections and blocks taken from 2 stillbirths that came through the department in 2019. And this is the umbilicus of the baby. This is the umbilical cord and placenta. Everything to the right is inside the baby, and what we're going to be looking at is some tissue sections between the bladder and the umbilicus. So the first one we're going to show you is just a section of the umbilical cord like this. This is normal on the left, hypertensive with the hyperplasia of the tunica media, which is the key finding in this condition. And then I'm going to show you it in the cord like this. But this is all a little subjective, and although we can use histological stains for hyperplasia of the tunica media, we think there's better ways of looking at it. And this is a section taken from inside the baby between the bladder and the umbilicus, and we've made a section through the what's an embryological remnant called the uterus and both umbilical arteries. And this one's been stained for nerves, and you can see this brown appearance on both the right and left umbilical arteries, which demonstrates injured vasomotor nerves around both umbilical arteries in this particular baby. Now, what we think has happened is that everything on the left here is not in the normal arteriolar nerve, vasomotor nerve. On the right is the injured arteriolar nerve. And what we think happens is there's an injury to the vasomotor nerve because of high intravascular pressures, probably caused by maternal stress and placental transfer of adrenaline and noradrenaline from the mother to the baby. That releases a soup or a shower or a storm of cytokines, which injures which causes nerves to regenerate from the proximal stump, and the wall of the arteriole to thicken, or what we call undergo hyperplasia, because this arteriolar wall is now denervated in comparison to the original normal situation. So there are 2 effects, one on the regenerating nerves and the second on the thickening of the vessel wall. When we look round the baby and all the different organs, if I draw your attention to this column on the right, what just brown staining is for nerves, pink is just the normal histological stain that pathologists use. But what you can see is injured nerves in all these different organs around different blood vessels. And it's the same at higher power. This time we've magnified it to 400 times. And just draw your attention now to this particular panel, looking at the pancreas, where we see a lot of injured nerves in the celiac plexus, which immediately applies to the posterior surface of the pancreas. And we think this might be significant in the development of type 1 diabetes. And this is showing it again at high power. This is in the kidney, this is in the pancreas. Here we see injured nerves around the renal arteriole, and here we see loss of nerves in the celiac plexus associated with the pancreas. And we think this may be significant in terms of the fetal origins of adult disease hypothesis put forward by David Barker in 1993, because what he found was a very high rate, or a higher increased rate, of hypertension and diabetes in low birth weight babies. So in other words, when they were born, they were small, but when in adulthood, they had a much higher incidence at an earlier age of both hypertension and type 1 diabetes. It's called the Fetal Origins of Adult Disease hypothesis. Dr. Barker put forward this idea that it was programming that was the fetal, some degree of fetal programming of the DNA that was important. We think a simple autonomic injury to the kidney and pancreas may be sufficient. This shows the same in adult hypertension. We'll go into this in more detail in a later video, but what you can see here is the kidney, spleen, pancreas, and adrenal with thickened arterioles here. That was first described in 1937 by Alan Moritz and Mary Old. Then in the second column, you see injured nerves around all the arterioles in the kidney and the spleen, loss of nerves in the pancreas here, and injured nerves again in around the adrenal arterioles. Importantly, the uterine vessels stain positively for nerves here, but also for this unusual stretch receptor, which becomes important in terms of pregnancy hypertension, and we'll discuss that in the next video. So in summary, this is a histological diagnosis, fetal hypertension. We see similar injuries in adult and pregnancy hypertension, and the injuries in the renal and pancreatic systems may be important in terms of the fetal origins of adult disease. In other words, they may be more significant in the adult situation. So this is a new syndrome of fetal hypertension. We've only seen a handful of cases. We think it's caused by maternal stress and adrenaline and noradrenaline going across into the fetal circulation, and it causes these tremendous differences. In this country, we see it a lot in third trimester maternal fetal cardiac problems, which seems to be one form of presentation. But we've got to confirm it in histological terms, and we haven't done that as yet. As I say, it may be important in terms of later adult diseases, particularly hypertension and type 1 diabetes mellitus. So thank you for listening. We'll do pregnancy hypertension and adult hypertension in the next two videos. And we'll always try and present you with something a little novel, something a little new that you can think about in the context of your own clinical practice.